What drew you to a career in public health?
Well, I've always felt the need to really give back, and I know that's one of my purposes in life is having the opportunity to help and support others. And so, a lot of people in my life have helped and supported me to get me to where I am now in my life. And so, why not give back? And being a public servant, sometimes you feel like your community property, but it's very incredible when you're able to touch lives of people and see those people's lives transformed.
What types of projects have you coordinated or helped with this past year?
Oh my goodness, really? No.
Pick your
Well,
favorites.
HealthCore Clinic is really working on creating an integrated health complex in the community to really address a lot of the health disparities and some of those social determinants of health that impact the overall health of our population. And so right now we're putting together a $10.7 million construction project that has 33 exam rooms, 11 integrated behavioral health rooms, a 7-chair dental clinic, a pharmacy, physical fitness area, walking path, community garden. All of our patients have access to these services regardless of their ability to pay because it's an incredible opportunity to be a blessing to our community.
What are your future aspirations for public health?
Oh, goodness. What is it? World peace, world hunger now. But really having the opportunity to be an advocate for some of the social determinants of health in our community or those health disparities that are due to issues around access. So providing real access, hashtag real access to services in our community that really will improve the overall health of our community.
If you had to pick just one topic to shed more light on or fix in public health, what would that be?
Oh, geez. I would say I would go back to real access because sometimes you can build a health facility just like we've built a health facility. But if you don't really have access and access in a way where people can come in and get those services that are being made available, then you've built a wonderful facility. And I know access is one of those things that's invisible. We can't see it, we can't touch it, we can't feel it. But if it doesn't have a strong advocate behind it that's helping us all look at our organizations in a way that we are able to open our doors and open our hearts and open our financial ability to truly serve our community so that they have access so that we can in turn decrease some of these health disparities, but then also increase the quality of life of individuals living in our community.
All right. What are some of the challenges you've come across in public health?
The greatest challenge to me is communication. I mean, communication across public health organizations. You know, it's a big public health sector. But if we're not all communicating, we're duplicating things that we could build capacity on if we work together. So being able to find better ways for organizations, especially non-for-profits, to be able to work closer together so that we can use all that we have in a way that makes sense and it helps improve our overall capacity to best serve our community.
How did you get your start in your career in public health?
Well, I started out here at HealthCore Clinic as a patient. So I was going back to graduate school, and I had a 4-year-old and a 2 and 9-year-old. And my 2-year-old at the time, he had asthma. Didn't didn't know a whole bunch about asthma. I came here to the Center for Health and Wellness at that time, and they took care of me. You know, they got him a spacer for his albuterol spray, and they really helped him get healthy, and they really educated myself and my daughter. And from then on, I continued here at HealthCore Clinic as a patient so that my health insurance would help someone else, just like I was helped when I was without insurance. And so fast forward, I'm still here and I'm still serving the community as a patient, as a past board member, and also now as the CEO.
What's the best part of your job?
The best part of my job is every day I leave here and I believe that I've helped someone. Whether it's an employee, whether it's someone in the community, whether it's our patients, I can't leave this building without walking through the lobby. And so every day when I walk through the lobby and I ask someone, do we take care of you? And they smile and they say yes. I mean, that's the best thing ever.